Welcome to The Audience Connection. This is the podcast where we focus on how businesses can create content that builds more genuine connections with their audience.
Each episode, we dive into the art and science of storytelling, speaking with the sharpest minds in brand, marketing, and creative storytelling.
Our guests share their strategies, insights, and creative choices that made their audiences care.
Brought to you by Casual, the video partner for global brands. With offices in the US, EMEA, and APAC,
Casual leverages the art and science behind creating impactful stories to drive business results for their clients.
We're your hosts. I'm Lydia Chan.
And I'm Ollie Atkinson. This is The Audience Connection. Hey everyone, and welcome back to The Audience Connection. It's Ollie here, and I'm here with Lydia. How are you doing, Lids?
I'm doing well, Ollie.
Good. Well, I hear today you've had a conversation with Terrence Wiggins, Global Marketing Director at Cook Medical. How did you guys get on?
I did. I actually met Terrence at an event, so it was really great to have him on the show. Terrence is really a 25-year marketing veteran. He's been in an industry, for over 2 decades. Really kind of mastering the art of building trust and forging authentic connections, which is what we're trying to do on this show. And I think that, our discussion really dives into creating content also in a very highly regulated industry. So I think that would be really interesting for the audience to kind of get his sort of insights and experience on.
Completely. We know at Casual how difficult it can be sometimes in those regulated industries like medical. So really looking forward to seeing how you guys unpack that. Okay, well, let's dive in.
All right, Terrence. Really great to have you on the show. For the audience, Terrence and I met, back in April. I feel like it was only a few months ago, but now we're in August. But Terrence and I met at a conference, and I thought it would be really great to have you on the show to kind of talk about your expertise. So I'll just kind of toss it over to you, Terrence, for just a quick intro.
Well, thank you. And first, I want to say thanks for inviting me part of your show. I did enjoy meeting you back in April. We had a nice little lunch together and then continue to bond and having discussions. So therefore, we came across this opportunity. But for those who are listening, my name is Terrence Wiggins. I'm the Director of Global Marketing for Cook Medical Vascular Division. I lead a global team focused on both upstream and downstream marketing. And I spent over 25 years in MedTech. And my passion, my drive is really around, bringing that mission of helping interventional radiologists, cardiologists, and vascular surgeons navigate innovation and be able to tell our stories through our marketing stories to get them to adapt to technologies that we have here at Cook. So that's a little bit about me, hopefully 30 seconds or less.
Well, thanks for that, Terrence. So, on this podcast, we focus directly on audience connection, right? So what's really important is to define our audience. And, when we spoke, you mentioned not just talking to one group of individuals, right? And I think this is, the same for a lot of different companies, right? It's not just about talking to consumers. Sometimes we have to talk to stakeholders and other, individuals that we need to connect with. So who are your audience groups? And, how do you, define them into segments?
That's a great question. When we look at audience group, it has changed. I think traditionally, because we deal in med tech and medical devices, the primary audience were physicians that are using our devices that ultimately serve their patient needs, right? But fast forward to this new age and time, what we're doing is our message is a little bit broader. Our message is talking to the CFO of the hospital and understanding how we can be of value to reduce case costs and drive more patients in and out of the facility. A question or a tool we may use is some type of economic tool or dashboarding type tool. Another opportunity that we talk to is we look at, for example, maybe a short testimonial for the patient and their family to understand the medical device that they're getting, right, is helping them. Physicians can use that in their in-services and their clinicals, right, to showcase around the technology through models or, like I said, patient stories as well. Obviously, the physician is definitely a segmented area, understanding that our devices or any medical devices, right, can show that it's going to meet an unmet need or show that it's going to be ease of use or like I said, it's going to provide that true value proposition of why this product versus the other product. And the last segment is really the staff that's helping the physician. They too have, obviously families they need to get home to, and they want to make sure that the devices that they're using, they understand how to troubleshoot it, make sure it's available, prep it, size it, whatever they need to do to make sure it's a good case overall. And being able to showcase, like I said, the product and how it works and why it works well is part of that storytelling as well. So there's really like 4, maybe more. I'm probably forgetting some. When we put together our stories, that's what we're really focusing on.
These different groups care about different things. If you can break down for us just kind of what resonates with each group, right? And maybe, and this is kind of multi-layered, right? But I always think about content in a sense of like, how do we go about this particular, whether that's story or project, and how do we reach all these different groups within the same like project or scope? And what I mean by that is that if we're going about a patient's story, how do we create content out of this patient's story or out of this interaction with the patient to hit all these different groups, right? We'd love to hear about that.
Well, again, I think it's important to be able to show how is that really driving those patient outcomes with that patient story. It's a very humanizing opportunity when you see a video and that patient on the other side could be your mother, your father, your grandmother, your aunt, your uncle, your daughter, right? And understanding how it's able to help whatever the specific disease state, right? Because we actually have a couple different products that are multiple disease states that it focuses on. And showing case, like I said, how it's driving value for a quality of life for that patient. That's important. Again, for the physician itself, how can he or she be able to use that device to be able to get to that end result of what that's supposed to be? Or sometimes, let's be real here, devices don't work as expected. How do we troubleshoot them, right? How do we work through some of those areas? And then at the end of the day, also hospital executives, their time is very limited. They're bombarded with a lot of different messages, and we need to show that our devices can have a clinical outcome and have a clinical impact that directly ties to the financial, that could directly ties to the operational opportunities as well. So therefore, they have that peace of mind that they're providing their physician employees with the best tools to be able to have and drive, like I said, those great patient outcomes. So it's really just thinking about the audience and thinking about the tools that you have and which tool to pull out or which story to tell about that tool to be able to, drive impact.
Yeah. I guess let's get down to the practical like tools, right? When you think about the different audience groups, what tools in your experience has worked really well for certain groups and actually just like don't work at all for other groups?
Yeah, that's a great question. I mean, I'm going to take a step back and think about the channels on how we sort of, embrace. And then you can talk a little bit about the tools and why they're impactful or what. For example, I'll talk a little bit about social media. Social media, as you would say, and I'm not talking about Facebook or Instagram. You're not really going to see our products there. You may hear about our company there, but you'll see the impact really maybe on a LinkedIn where you have a bunch of physicians that have used the first case of a device, and it's inspiring maybe to others to really try to drive that awareness of why was that case so successful or why did that go so well, right? And so therefore that broadens your message from an awareness standpoint, because you're in that awareness area to maybe drive engagement. And then what happens is maybe it's a physician, maybe it's somebody at the hospital where they're going to the company website and trying to find out how they can get a local rep to come in to do an in-service or some type of training. Medical education is a big piece of this. Again, these physicians are obviously go through medical school and trained, et cetera, but the devices are constantly evolving, right? The device that you were trained on maybe 15, 20 years has changed, or there's been new devices or new iterations. So I think that's another piece of it, is getting that inside the hospital and then obviously getting it on contract, whether it's a GPO contract, getting it, sort of on the shelf and then being used is a full sort of process.
Yeah.
And those stories, the tools that you use, it could be from economics, could be clinical, it could be just as simple as, look at how this case performed. But there's a lot of different tools that you use within that storyline.
There's definitely a lot of different tools at our disposal, but I guess it's really how you tell those stories and, what tools you use to tell those stories, right? So, for us, when we think about storytelling, it's from a filmmaking perspective, but there's many different ways of telling stories, such as whether that is, again, through copy or, through literal like presentations as well. So I guess, what have you found to be the most effective in trying to achieve certain goals, right, for each of the audience groups that you're speaking to?
That reminds me of a story that a real life example that has literally happened, and I think it's around trying to drive that connection, and not beyond just beyond the product, right? That connection to the company, that connection to why should you use this sort of procedural solution, and why does it matter? And I'll give you a quick story. Me and my team was able to sit in front of a chief of vascular surgery out of Chicago, and we really wanted to talk around brand perception of us as a company, where we're going, where we've been, what's missing, what do we need to highlight. And we had some challenges in the past from a brand perception, and we outlined that. I mean, we came out of COVID. There was obviously some supply chain, not just my company, but others. We came out of maybe some lack of innovation, and when you're not innovating, obviously your brand perception scores sort of not, they don't go in the right direction you want them to drive. So I think showcasing why some of those things has happened, and also maybe take a peek underneath the hood and look at who we are as a company. What happens is you drive that deeper connection. And I saw the shift literally on the call was from you're trying to sell me the devices. Oh, I really understand the impact that you're making and what you're trying to do with the innovation pieces. And now it turned me from maybe hands folded to embrace, how can I help? And again, that's a great story without, video or anything like that. It's just having that and being able to approach physician communities to showcase all the things that we're doing to add value for the future.
That's a great anecdote, right? I think it's really identifying what stories we're telling. You kind of need to think about, like you said, actually, this story is about innovation, and that is what the audience is really gravitating towards right now at this moment in time. And I think that's super important too, is thinking about where we are at this moment in time and how do we create content that is connecting with people.
You got to ask what's in it for them, right? I mean, we only have so much finite time, and there's so much happening and so many different stories. And really, I think asking questions, better understanding, and it goes back to the connection. The deeper you know your customer or whatever story you're trying to tell, you can tailor to that. I've read this book, and I've read a lot of Seth Godin's book. He's a marketer, which I love learning from, and you can Google him, but he's an entrepreneur. He's done a lot of marketing philosophical books. And he read this. There was one book titled "All Marketers Are Liars." Well, that's not the truth, right? We're storytellers. But again, it's I think what I got out of that book is telling an authentic story, not just a story, right? Trying to figure out what is that authentic story that drives that connection. That's what's important, because we can all be told stories and we all have that sniff test, like, that smells a little funny to me, right? That's the whole point of the book. Telling authentic stories is what matters.
Yeah, no, 100% agree with you, right? I would love to hear where you have seen, or even in your own kind of practice over the past 20 years, when things have gone wrong, right? Or not wrong, but it's like, oh, we really truly believe this this initiative or this way of telling a story or what have you, right? And that it didn't go the direction that we want it to go, and what was learned from it.
Yeah, that's a great one. I think it has to go with setting that foundation of trust and consistency, right? And if you say one thing and it doesn't sort of, if you have a story and it doesn't sort of act the way it's supposed to, the device fails, you're having a difficult time or a challenging time, or the outcome wasn't achieved. It depends on where your relationship is, right? Have you had a long history of having good devices that has been able to meet the needs of patients and obviously have great quality? Or are you new, and you're trying to do that? Well, guess what? You set a probably bad first impression, but there's ways to still get to the obvious point of how do you build out trust, is admitting that, hey, didn't realize this was going to happen, figure out a way to make it right, and you may get a second or a third chance. And just being, I guess, like I said, trust and open and vulnerable to explain. That didn't go well. Let's talk back what went wrong, right? There's a lot of different reasons, and we're not trying to, pass the blame or point the finger, but working together to get to an opportunity to understand how you can build that trust. And then also, like I said, how the device can work, or whatever the solution is, can work the way it's expected. And it takes time. And it takes a lot of effort, but I believe for the right reasons. I know the company I work for, we really are focused on trying to drive those deep connections to build that time together.
Yeah. There's a couple of things that you just mentioned that I really want to dive deeper into. One of them is things that go wrong and having to address it, right? But of course, in such a regulated industry, an industry where there's so much red tape or compliance, how, I guess, what advice do you have for other marketers in similar industries, right, to be able to be vulnerable and be authentic in your storytelling, but also navigate these restrictions that are put on us in how we communicate externally?
The one thing I like about working in the healthcare field is we are heavily regulated, and we do have certain boundaries we have to play in. Never want to cross the line. We do want to go up to the line, and sometimes physicians may want to push the line because that's how innovation is made, and in an experimental testing way, right? And so there's ways on how you do that, but specifically in healthcare, it's really focusing on making sure that we build that trust, we build that equity, we have a great compliance team. Most companies do have a great compliance team to make sure we're playing within those boundaries. You never want to go outside of that because there's obviously consequences, right? And I'm sure you can Google many stories of maybe companies that has sort of, like I said, crossed the line outside of those compliance areas. But the nice thing about, being here is we need to be able to understand that in a regulated medical device area, we do have specific claims and different data to back it out. Our stories are backed by data to really drive the outcomes, right? I could say this X device is 75% better than our competitor. Well, I can't say that because I have to have the data. So the proof helps us drive those stories even more, right? What does the data say over long term? And it's studied, it's examined, and data points really drive some of our storytelling as well.
Yeah. That's super important. I definitely have that to touch on as well, right? Using data versus emotion, right, in our storytelling. But I do want to touch on the second thing that came up from your previous answer was consistency and how it plays a role in earning trust with your audience over time, right? And I think that can be a learned thing across all industries, but I see brands sort of not being consistent with what they're putting out in regards to their stories, their content, their campaigns. It's almost like, this project's done, wrapped. Okay, what's the next idea, or like what's the next campaign or story, right? Versus trying to kind of build on this storyline over time to be able to build that audience trust. What would you say is, how would you convince folks to really kind of put the seeds in, right, to be consistent and to, and that will earn trust for your audience? Like, how do you convince folks to kind of stay true to that consistency?
It's how you show up. It's how you show up, how you represent, How do you go back, and you don't have to always point back to the proof points. People can pick that up and they can notice that. I'll give you another quick story, right? I have this favorite restaurant that's downtown, and I go to it, and when I go there, I pretty much order the same meal and have the same type of drink. And it's that consistency of that drink and that meal. I get the same experience. Well, sometime there was some new management, new ownership. I went there, food was a little bit colder. The drink didn't have, sort of that same taste. I don't know if they did something wrong, but that's okay because they built equity with me over time. You go there 3 or 4 times, and if you're not getting that consistency, then what happens? You stop going to that restaurant, right? You start to try something new. So I think it's important where it's how you show up. Even if there was a change in management or, hey, we're going through some learning troubles, et cetera, being transparent and being upfront about that is important. We take that story, we translate into healthcare or just storytelling important. If there's things that is happening, being upfront, showing that transparency, having that as a value is important. And then trying to make it right. And if you do those 2 things, that adds that continues into their consistency. Things may not be exactly how you want it, but you better understand and you have a little bit more empathy, right? So I think those 2 things, how you show up, right? And then explaining, being transparent will add to the consistency over time.
Yeah, absolutely. I want to jump to the data versus emotion, right? I think, when we think about storytelling, and again, from like a video and filmmaking perspective and in the healthcare industry, a lot of folks think about patient stories, right? But, we know in working with a lot of healthcare biotech kind of clients that actually there's physician stories, there's kind of the, internal recruitment stories, there's the thought leadership kind of storytelling. And then, of course, yes, there's the patient stories, right? And I think when it comes to data versus emotion, there's always going to be a group, an audience that leans heavily in one area, and then a group that you should lean heavily on another area. So I would love to hear your take around how do we use data versus emotions in that type of storytelling.
And you know what? You can do it either or. When you say both of those things, you can lead with the emotion, and it may grab some people to lean in more and better understand, and hit them with the infographic, hit them with the data point, right? And we've seen that in I've seen a lot of pharmaceutical commercials, to be quite honest. That's where I see it the most. Or you can do the other, right? With an alarming question or a data point. 90% of patients have living with peripheral arterial disease. Learn how you can, XYZ, right? So both can be hard hitting. I think it's important to have in your toolbox the opportunity to experiment and do both, because some folks are going to want to lean in because you did hit you hit a fact, right? Facts tell, but also stories sell. So then you have to think about, okay, you got me with the hook. What is it? What's that call to action? What are you trying to make me do differently? Are you trying to make me, if I'm a patient, are you trying to make me visit a physician? If I'm a physician, are you trying to change my practice? Right?
Yeah.
If I'm a hospital administrator, am I trying to understand the benefits for the overall hospital? At the end of the day, a story is grabbing with a hook. Again, data, you can do it with data, you can do it with patient videos, but you should have something that you want to have a CTA, right? A call to action that learn more, reach out here, right? What is your overall call to action? That's the important. But to answer your question, I think you can do both. And I think you should do both to mix up the story a little bit.
Yeah, I 100% agree with that, right? It's doing both, but again, the sort of, is it like 50%? Is it, 50-50? Is it, 70-30? And then where, right, within that story, do you sort of hit them with those things? So I totally agree with that. Well, Terrence, in kind of wrapping up and looking ahead, right, what should marketers in regulated or kind of high stakes places like you're in, what should they be preparing for for the future?
I think 2 things. It's around personalization, customization, right? And also proof. we talked a lot about on this podcast around the data. And I think if you audience expect messaging that's tailored to them, and that's the hard part, because even if it depends on the top of the funnel, the middle of the funnel, or the bottom of the funnel, you got to be able to understand, again, why does this matter? What's in it for me? And so hook them, bring them down through the funnel. But if that story is still the same and it's not personalized, and if you don't have any proof points, you might lose them outside of the funnel. So being able to make sure you walk them through that storytelling algorithm and be able to understand what's in it for them. What's that segmentation? What's the persona? What ultimately is the value that they're trying to get to? And if you can really master that, I think any company that can do that very well will be able to win the hearts and minds and win the hearts and minds of their customer.
Well, Terrence, I think we can stop there. Thank you so much for this great conversation. I really appreciate having you on the show.
Well, Lydia, I want to say I'm very grateful to be here. I have a lot of passion and energy for what I do. When I was an 8-year-old, you would ask me, what did you want to do? I always wanted to be a marketer. Most people wanted to be a doctor, a lawyer, a fireman. So anyway, people can follow me on social media, follow my company on social media. I love what I do. And I'm very grateful that I was invited on to talk a little bit more about what I do every day. So thank you.
Thanks for tuning in to the Audience Connection podcast. If you enjoyed today's episode, don't forget to subscribe and leave us a review. If you'd like to connect with me about how I can help you tell better stories and connect better with your audiences, drop me a note, lydia@casualfilms.com. We'll be back with more episodes soon. See you next time.